Hi, I'm Khristi Tomlinson, and today I'm going to talk about marriage and family therapists. So, what will we talk about today? First, I'll give you an overview of what marriage and family therapy is all about. Then, I'll cover the North Carolina requirements to become a licensed marriage and family therapist. We'll talk about what makes marriage and family therapists different than other counseling specialties. We'll cover the theories behind marriage and family therapy that make it special. And we'll cover the strengths and the weaknesses that marriage and family therapy may have compared to other counseling specialties. We'll talk about what a marriage and family therapist does every day. And then we'll talk about unique factors that are important to consider if you want to become a marriage and family therapist. Finally, we'll sum up what we talked about. Marriage and family therapists, also known as MFTs, treat individuals, couples, and families. They take a holistic approach where they are considering the entire person and their life, not just the problem that brought them in, like depression or anxiety. They're trained in a systems approach, which means they don't just look at the individual, they look at that individual in the context of their relationships with their family, with their spouse, with their friends or coworkers, whatever's appropriate. MFTs care about how the clients communicate and the relationship dynamics they experience in their environment, their work environment, their home environment, their marriage environment. They are also trained in psychotherapy, which means though they do take a broader systems approach to how they identify problems and treatments for a client, they're also able to diagnose individually the way other mental health professionals can. They can treat almost any mental health condition, and their treatments are as effective or even more effective than those of other approaches. MFTs specialize in short-term solution-focused treatments. Maybe they don't want to dig into all the whys, they just want to fix what the cause is and what the effect is so that their clients can be happier and more comfortable with better relationships. Before we continue with the presentation, let's talk about the alphabet soup that is all the organizations governing marriage and family therapy. First, we have the AAMFT, the American Association for Marriage and Family Therapy. That's the governing body that sets ethical standards, educational standards, clinical and professional standards. We have a North Carolina affiliate called the NCAMFT, or the North Carolina Association for Marriage and Family Therapy. Next, we need to think about the AMFTRB, the Association of Marital and Family Therapy Regulatory Boards. They're in charge of the MFT national exam. In North Carolina, the North Carolina Marriage and Family Therapy Licensure Board, or NCMFTLB, handles licensing for MFT associates and fully licensed MFTs. Finally, COAMFT, or the Commission on Accreditation for Marriage and Family Therapy Education, sets the standards for what a marriage and family therapy master's, doctoral, or other programs must contain in order to meet their standards. So, what do you have to do to become a marriage and family therapist? First, you have to have an advanced degree, a master's or a doctorate, preferably from a marriage and family therapist program accredited by COAMFT. If you have a degree from another type of mental health profession, you can do some postgraduate work and get a COAMFT postgraduate program for that additional 3 to 5 years of training. After you complete your degree or training, you can apply to take the AMFTRB national exam. Every state except for California uses that exam, so that's useful in case you want to be licensed in more than one state. When you pass your exam and are approved for your license, you'll receive your LMFTA, or your Licensed Marriage and Family Therapist Associate. You will then be able to get your supervised hours and your clinical hours under the supervision of an AAMFT approved supervisor or supervisor candidate. That's very important because hours that you get supervised not by an approved supervisor don't count towards your licensure. You're going to need 1,500 total clinical hours, and you're going to need 200 supervised hours at least. When you receive all of your clinical hours, then you can apply to get your full licensed or your LMFT, licensed marriage and family therapist. You can go on after you have enough experience and apply to be a licensed marriage and family therapist approved supervisor. That requires 180 additional supervising hours and 30 hours of coursework, plus several other conditions you have to meet. Let's take a look at the job outlook for marriage and family therapist. Good news. It's expected to grow over 13% through 2034. Just like other mental health professions, there's a big need for marriage and family therapists. I've included the local information for Raleigh and Cary. You can see that the United States average is higher than a lot of the ones around here, the salary levels around here. But that's probably because over 50% of marriage and family therapists are located in California. And California generally has a lot higher salaries because their cost of living is so much higher. Marriage and family therapists work in a lot of different areas, as you can see at the bottom of the slide. You don't just have to go into private practice. Actually, only about 13% of MFTs are self-employed. So you have a lot of options, and those options have obviously different salary implications. In North Carolina, the easiest way to reach your licensure goal is to attend a Coamphety accredited program. You can get your master's or your doctorate. If you don't attend an accredited program, you have to submit your original syllabi from your courses in the program you attended to see if they meet the standards set by AAMFT, which is what North Carolina Licensure Board follows. You can have a degree in psychology, clinical social work, or any other kind of similar specialty as long as you meet those requirements or you do the additional coursework necessary to meet those requirements post-degree. In North Carolina, there are two programs at Appalachian and at ECU in marriage and family therapy. They're Master's of Science programs and they require 51 hours over the course of 2 years to get your degree. So you've gotten your advanced degree. What's your next steps to becoming an MFT? Well, you have to apply to the North Carolina Marriage and Family Therapy Licensure Board in order to receive an approval code so you can take your national exam. Part of your application has to include the name of one or more AAMFT approved supervisors who agree to take on your supervision requirements post-degree. You also have to submit 3 character references, and you have to pass the background check, which is only required as of October 1st of this year, which is a little bit shocking. After you pass the exam, then you complete your clinical hours and your supervised hours. You have 3 years to make that happen. And you also need to keep in mind that even after you complete your required 200 hours of approved supervision, you can't just skip supervision until you are fully licensed. You have to receive at least 1 hour per month of supervision until you are officially awarded your full LMFT license. So let's drill down on the specifics of what's required to get your full licensed marriage and family therapist LMFT designation. First, you have to get at least 1,500 clinical hours. At least 500 of those hours have to be relational, which means more than one person needs to be in the room when you're providing therapy. Couples, families, that sort of thing. You also have to have at least 200 supervised hours from an AAMFT approved supervisor or supervisor candidate. There are no exceptions. Other supervision just doesn't count towards licensure. The good news is that hours that you acquired in the course of your internships and practicums while you were getting your degree count. Up to 500 clinical hours count, and any amount of supervised hours count as long as it was from an approved supervisor. Your remaining 1,000 clinical hours have to be gotten after your licensure as an LMFTA. Keep in mind that even if all 200 supervised hours were required pre-LMFTA licensure, as in during your degree, you still have to complete 25 approved supervision hours after you receive your LMFTA or post degree. When you finally complete your 200 supervised hours, that doesn't mean you can just stop being supervised. Until you are awarded your full LMFT license, you're still required to have 1 hour of supervision per month. And let's talk about what supervision actually means. It's a little bit different for marriage and family therapists than it is for a lot of other mental health professions. AAMFT approved supervisors or supervisor candidates have to have face-to-face conversations with LMFTAs, and they have to witness live therapy sessions. They have to review written clinical notes. They can do co-therapy, or they can look at audio and video recordings. This requirement for one-on-one face-to-face supervision is more stringent than other mental health professions. Fun fact, the marriage and family therapy license that's displayed here on this slide is the first image that came up when I searched for it today or the other day. And it's actually from Bryn Clayton, who was a friend of mine in high school. So I reached out to him. I hadn't talked to him in years and years. And he got his degree from the seminary up in Wake Forest. And he's very happy being an MFT, fully licensed now. MFT licensure is regulated in all 50 states. Every state except for California requires that candidates pass the AMFTRB National MFT exam. That makes it easier to apply for licensure in other states. Unlike other professions like nursing or even social work, you have a lot less license portability with your MFT. North Carolina doesn't have any agreements or are members of any compacts that allows the North Carolina license to let you practice in other states. North Carolina does allow for reciprocal license, and they can be granted under certain circumstances. You have to currently have an unrestricted license in good standing in another state without any unresolved complaints, and you have to have passed the National Marriage and Family Therapy exam. That's not a problem for any kind of licenses except those issued in California. As of October 1st of this year, the former 5-year of continuous years of experience requirement has been reduced to 2 years. The North Carolina board website says that accurately, but that conflicted with what the statute said. So I reached out to the executive director of the North Carolina board, and she very kindly explained that it was brand new as of October 1st and that the statute that it was linked to on their website just hasn't been updated yet. Additional requirements for licenses are that you have to renew them every year, like on July 1st, instead of every 2 years, as a lot of other states require. You have to complete 20 hours of continuing education, and 3 of those hours have to be about ethics. Marriage and family therapists have several things that make them distinct from other mental health professions. MFTs are uniquely trained in systems thinking about relationships. They're also focused on couple and family dynamics, how people interact, and how that affects them individually and their relationship. And they are trained to take short-term approaches that have concrete results that are attainable and not sort of continuing therapy on for long periods of time. They take the systems approach, not a biomedical approach like other mental health disciplines. What does that mean? A biomedical approach is one where you look at an individual and you make a diagnosis. Just like you might say, this person has diabetes, you might say in a mental health capacity, this person has depression or this person has anxiety or any other kind of condition. When you have a systems approach, you're not diagnosing the person. You're looking at what affects the environment that that individual is in might have on their mental health and their well-being. What effects does the relationship they have with their spouse or their children or their parents? That you can't look at an individual by themselves under systems theory. You look at that person in the context of its greater relationship environment because everything is a feedback loop. You are not just depressed. Your depression may be affected by how your parents treat you or how you interact with your spouse. The good and bad dynamics of those relationships has a big impact on people's mental well-being. Because of this, the idea behind marriage and family therapists is not to diagnose people. They don't believe in that. They believe in looking at how you can improve the dynamics of the relationships that the client is in to help change patterns, break generational patterns, and improve communication to improve overall well-being. They want the whole person and their environment to get better, not just to cure depression. So this is different than a lot of other mental health professions, but it doesn't preclude marriage and family therapists from actually doing the diagnosis that's required in the United States for insurance purposes. So they can treat you as part of a system, but it still gives them the ability to make the diagnosis of depression or anxiety or whatever else is appropriate so that you can receive payment from insurance companies if they just choose to do that. Another additional difference is, as mentioned earlier, MFTs, in order to receive full licensure, require live supervision by qualified and experienced approved supervisors. This lets the MFTs have more hands-on supervision so that they can do a better job with the extremely complex interdynamics that they will encounter in dealing with family and couple dynamics. Systems theory is the big theory that underlies marriage and family therapy. System theory was originated by Ludwig von Bertalanffy. His quote from our textbook is, "Any organism is composed of interacting components mutually affecting one another." That's a big idea. And I had a little bit of trouble wrapping my head around the specifics until I listened to a podcast from the AAMFT about the evolution of systems theory. It turns out it's a little bit loosey-goosey. There's a lot of sub-theories. There's a lot strategic theory, structural family therapy, Bowen system theory, and a bunch more. There's a lot of overlap between them. And it's not as well defined as perhaps some theories in other mental health professions. It's a great approach, though, and it gives you a lot of flexibility about thinking about solutions and thinking about what causes different problems for individuals. When you are engaging in system theory thinking, you're thinking about very complex dynamics and interactions and communication, and all of those give you a big picture of what is going on in an individual's life, not just looking at the specific problem the individual is having. You can also keep in mind that despite taking a systems theory approach and that whole viewpoint underlying the whole thought behind marriage and family therapy, marriage and family therapists also employ more traditional approaches like attachment theory, CBT, and other therapeutic approaches. They all can work together in harmony and be used as needed for individual clients' needs. So, what are some good things about marriage and family therapy? Well, treatment from marriage and family therapists tends to be very effective. Over 80% of couples receiving treatment were better off than couples that did not receive treatment in one particular study. Improvements from MFT treatments last for months or for years, as shown in several other studies. You can look at specifics for different conditions, and it's been shown in studies that MFT systemic interventions might be really better than other interventions for children and adults that have experienced trauma. You can also see that MFT has the same or better results for a lot of different mental health conditions, such as depression, bipolar disorders, anxiety, and others. There's been a lot of studies looking at their effectiveness for these different areas. And in general, marriage and family therapy is at least as effective or more effective than other approaches. Most of the time, these are cost effective therapies and approaches because you're dealing with short term therapy. They're looking to get in, identify a solution, and then wrap that up after helping people achieve their goals. And marriage and family therapists can treat more than one person at one time. So you're saving individual therapy treatments when you're treating, for instance, a family. You also kept seeing in several studies that marriage and family therapists are rated by over 98% of clients as good or excellent, and they're the mental health profession most likely to be recommended to friends. An additional strength is that marriage and family therapy members tend to fall along demographic lines that are more like the actual American population. So, for instance, only 14% of psychologists are people of color, but 37% of the degrees awarded in 2016 for couples and marriage family therapy were to people of color, which more closely matches the 40% approximation of minorities in the US population. Marriage and family therapy has a number of areas where they could do a better job. For instance, research in marriage and family therapy can be sexist, racist, and homophobic because it started out being generated by straight white men, and there's an assumption institutionally that you're comparing normal families, quote, two parent, white, straight families, to other kinds of families, minority families, single parent families, gay families. But you don't control for structural disadvantages in a lot of studies. So trying to compare your typical, quote, normal family against a single parent family of a minority that doesn't take into account that that family is more likely to be lower SES and have access to less resources. And that's going to have an effect on family dynamics and the success of family relationships. That kind of implicit bias needs to be corrected in a more rigorous fashion in the future. You also have the same kind of biases found in the theories that were developed. They don't take into account gay couples or how cultural viewpoints may affect families differently. There needs to be more work done in the development of those theories to be more inclusive of the kind of families commonly found in America today. In addition, marriage and family therapy training programs don't have the kind of inclusion of people of color that they could have. While 40% of the population approximately is a minority, and it looks like the actual number of minority practitioners of marriage and family therapy are approaching the demographic norm of that minority for our population. Only about 27% of faculty in MFT programs are people of color. When you don't have people of color in faculty positions, then it makes it harder to support and retain minority students because they may not be seen, feel like they're being seen or heard, and they may not feel like their viewpoint is being taken into account. Marriage and family therapy, while it has embraced taking a multicultural approach and has been making a big effort to be more inclusive, still has some work to do to learn how to better discuss racism and its effects on both its practitioners and its clients. Systemic racism is a very invasive problem that's not just obviously marriage and family therapy's problem, but as we are very keenly aware of its effects on the population, we can do a better job as marriage and family therapists to try to address those problems and figure out better solutions. Finally, while over 60% of the faculty at public universities in marriage and family therapist programs are women, they're paid about $5,000 less on average than men. They're underrepresented as full professors, and they get promoted more slowly. So the sexism that's found throughout society is still found in MFT programs despite our awareness and the majority of population of faculty being women. So there are some systemic problems in public universities that need to be addressed so that more leading faculty members and leaders of departments become women so that we can have a less biased viewpoint in leadership. So, what do marriage and family therapists do? It depends on where they work. Marriage and family therapists can work in a lot of different areas: hospitals, VA centers, universities, schools, prisons, and they can also work in private practice. Depending on where you work, you're going to have different duties and different day to day activities. What kinds of cases do MFTs handle? Well, they can handle almost any kind of mental health problem that any other kind of mental health professional can handle. While traditionally you think of a marriage and family therapist as doing couples counseling, premarital counseling, family therapy with children problems with their parents, divorce, things like that. And those are all very valid and a big part of things that make up a marriage and family therapist practice. But they can also engage in therapy for substance abuse and other mental health disorders like depression, anxiety, PTSD. They can handle gender and other personality disorders, um, sexuality issues, domestic violence. Those kinds of problems occur in the context of a family, a couple's relationship, and those understanding and helping with the relationship dynamics, especially in things like alcohol and drug abuse, can make a big difference in the long-term recovery and relapse rate of people who are helped and recovering from those kind of issues. What MFTs do, as we've seen, depends on where they work and what kind of cases they handle. But in general, there's some things that they all have in common. You may have more work to do as a marriage family therapist dealing with insurance, marketing, and things like that if you're in private practice. Whereas if you work in a hospital, for instance, the podcast I listened to, the marriage and family therapist was in charge of an obesity clinic. So he dealt a lot with specifics with physicians about how to help patients. Not looking at, well, how do we get them to understand to eat less, for example, because they already know that, but talking to the patients and working with the physician to identify what patterns in the family might contribute to them overeating or not being able to follow the guidelines. Their relationships make up a big part of their decision making and driving them to make choices to overeat or to eat wrong things. So the marriage and family therapist in that context would spend a lot of time talking to the physician about the patient's needs and talking to the client and the client's family about how to create an environment where the patient can be successful in losing the weight they need to lose. However, if you are working in a prison or if you're working in private practice or you're working somewhere else, you would have a different approach and you would talk with different people and you would have different duties. You might, in private practice, have to spend a lot of time on insurance that, for instance, the obesity clinic would never have to address. Everyone, though, is going to have to spend time reviewing and recording case notes, evaluations, and progress reports and they're going to have to develop and implement treatment plans for their clients. They're going to conduct therapy sessions with individuals, with their families, with their partners, whatever's needed at the time. And you may be treating a person on an individual basis and sometimes bring in other members of their family or their spouses or even friends that are causing problems that they're trying to address. You also have to spend time receiving supervision, discussing your cases or problems with your clients, with a supervisor, or even other coworkers in order to be able to figure out the best way to proceed and handle with their case. You need to spend a lot of time taking care of yourself because this kind of work is very stressful and burnout is a very real problem. You can't provide the best quality of therapy for your clients if you don't have anything left to give because you haven't taken care of yourself. And finally, all marriage and family therapists have to spend time training to stay up to date on the latest findings and recommendations for their field. Okay, so what are some unique factors you need to consider if you want to be a marriage and family therapist? Well, as mentioned previously, MFTs can experience a lot of stress, maybe even more than some other mental health professions. You're dealing with people in groups that usually have a lot of conflict. If you are not comfortable with conflict, if you don't know how to compartmentalize and separate the stress from work away from your personal life to let you take care of yourself, then this profession is going to be especially hard for you. Because you're dealing with groups of people usually, you have to be really good at being patient, and also at pacing because you are juggling the dynamics in that group to try to get everyone to participate and everyone to feel heard and everyone to agree on common solutions to support the family and the individuals. That's a very tricky thing to accomplish. You have to be able to think quickly on your feet, to analyze very quickly, and come up with a good solution to whatever might be blowing up in front of your face in that very moment. It's a little easier if you are not as good at that if you're in individual therapy because you just listen to one person and you don't have as much to think about. But when you're having to analyze and keep track of the interactions among multiple people, then that becomes a lot harder. So you have to be especially good at problem solving, analyzing, communication, and interpersonal skills. Being able to make very good decisions very quickly is very important. If you're in the middle of a big conflict between a couple, then you might not have the time to sit there and leisurely listen to someone ramble on and think while they're going through their problem, and that you'd have time to consider what approach you should take or what they're really saying. Multiple people ramps up the pressure, and you need to be able to handle that pressure. You also need to have really strong ethics and an ability to really build trust because when you're dealing with groups of people routinely, being able to balance everyone's needs in an ethical way and in a way that makes everyone feel seen and heard is a skill that is difficult to manage for a lot of people. And it's a little bit more challenging sometimes than just providing therapy where your responsibility is just to the one person you're treating and not to the mental and physical well being of the entire family. We've learned a lot of information today about marriage and family therapy. Should you consider becoming a marriage and family therapist? Well, the training is pretty equivalent to a lot of other mental health disciplines. You can get your doctorate or your master's. You have similar kinds of courses. Your licensing requirements are also fairly similar. You have to take a single national exam in North Carolina. You don't have to take any kind of other exam on the North Carolina laws. You also only have to take 1,500 clinical hours and 200 supervised hours to get your license, as opposed to, say, clinical mental health counseling, which requires 3,000 clinical hours. Another big difference is that marriage and family therapy takes a totally different approach to understanding how to diagnose and treat clients. They take a systems approach where they really don't want to diagnose, and they want to look at the client in the context of the family systems the client is in. They want to look at the relationship dynamics and the communication of their client with their spouse, children, parents, friends, coworkers, whoever might be relevant to the problem. That's a different way of thinking than any other mental health discipline. There's some good things and some bad things about marriage and family therapy. You've got a lot of the same problems that you might encounter in other mental health professions. Problems with systemic racism, sexism, homophobia, things that we can't escape in our society pretty much anywhere we go. But you've also got some pluses that maybe some other counseling disciplines don't have. Marriage and family therapy tends to be short, it tends to be very solution focused, it tends to be effective, at least as effective or more effective than some other approaches. And that can be very validating. If you want to really solve problems and then move on to new clients, it might be a good fit for you. But if you really want to get to know someone in depth and explore their backstory and everything having to do with what brought them to be the person they are today with their problems, you might want to be in a different discipline that has approaches that are not so short-term focused. You need to consider how you want to spend your time as a therapist. If you can't take care of yourself and you can't compartmentalize, then you may not be suited for this especially stressful mental health professional because you're going to have a lot more conflict potentially than you will in one-on-one therapy. But if you really enjoy the challenges and having to quickly think and come up with solutions while analyzing problems that are probably different every time because every family is different, then it may be a good fit for you. These are things to consider when you're trying to figure out if the investment of money and time is going to be appropriate for being a marriage and family therapist. Do you have the kind of mental flexibility and ability to be fair and balanced in viewing and handling the needs of all the people that you're treating in a family or another relationship unit? If you can't really feel like your judgment is you're not going to play favorites and you're going to treat everyone equally and ethically, then that's not something that you want to take into being a marriage and family therapist. You might be better suited for a mental health discipline that focuses on one person at a time. I hope I've given you enough stuff to think about and that you have a plentiful amount of information to help decide if this is a good fit for you. Thank you.